Hello, everyone. Thanks for your patience as we let everyone in. We're going to get started in just a second, but we want to make sure all the folks are on before we begin the program. So thanks for your patience.
Okay, let's get started. Welcome to the Maryland Legislative Agenda for Women's 2025 Legislative Wrap-Up. My name is Michael Cohen, and I am MLAW's president. This was a tough year for the Maryland General Assembly because of the state budget crisis and the effects of changes at the federal level. Legislators' focus was on some very critical challenges facing our state. But advocacy, women's, and family issues continue to be important for MLAW's agenda bills. As a result of this advocacy, MLAW's coalition of lead groups, organizations, and concerned individuals resulted in the successful passage of 5 of our 10 bills. Your efforts made a difference. We will hear about the importance of those legislative successes tonight, as well as the challenges that faced bills that did not pass. MLAW was created 30 years ago to harness the collective power of women to advocate for legislation that improves the lives of women and families in Maryland. MLAW was established as a statewide nonpartisan coalition of individuals and organizations that produces and distributes the annual legislative agenda with proposed bills selected by our members. With the addition of these 5 bills, MLAW has successfully supported 124 bills that have been passed by the Maryland General Assembly in the last 30 years. MLAW's democratic process for creating the annual legislative agenda begins when bills are presented at MLAW's annual fall conference by lead advocacy groups and legislators. This year's fall legislative conference will be held on Saturday, November 1st at the Meeting House in Columbia. If you are interested in a legislative issue or see a need for a change in the law, we encourage you to contact the lead group with issue expertise or a delegate or senator. You'll hear from some of them tonight. After the conference, paid MLAW members then vote to select the priority bills that are included in the agenda. By joining MLAW, you can have a vote on what bills are selected. We also ask individuals and organizations to sign on to the agenda to affirm their support and demonstrate our collective power. The more organizations and individuals that sign on, the more powerful we are. I want to thank all of you who signed on this year. Remember, you don't have to be an MLAW member to sign on. During the legislative session, we introduce and disseminate the agenda document to all legislators as well as advocates throughout the state. We collaborate with lead groups and legislators. We write letters of support, provide testimony. And provide information, updates, and legislative alerts via email, our website, and Facebook page. Through the legislative wrap-up and our final report, we communicate what happened during the session, our successes and disappointments, and what we may expect in next year's session. We invite you to get involved, to join and become a voting member of MLAW, to learn about the important legislation in the MLAW legislative agenda, and to make your voices heard by contacting your legislators about legislation that will make a critical difference to women and families in Maryland. Tonight's wrap-up agenda and the final report were sent out in advance, but there's also a link in the chat for both of them. The MLAW 2025 Legislative Final Report is also available on our website, along with the agenda document. Now, Board Secretary Sheena Foster will introduce the lead group advocates and legislators who sponsored the MLAW agenda bills. Please submit questions on each bill through chat, and we'll take them after the presentation of each bill. Sheena?
Hello, everyone. I'm Sheena Foster, Board Secretary for MLAW, as well as Commissioner with Montgomery County Commission for Women. I'm so excited to introduce all of the bills, the 5 that passed and the 5 that didn't. And I'm just going to take it out of order for just one moment, and we're going to introduce HB 629, SB 549, Civil Actions, Immunity, Disclosure of Allegations of Sexually Assaultive Behavior, which is the Stop Silencing Survivors Act by Lisa Jordan from the Maryland Coalition Against Sexual Assault.
Sheena, thank you so much. Thank you, Michael. And mainly thank you everybody who made phone calls, who reached out, who really helped improve the lives of Maryland women during the legislative session. I'm here to tell you about a bill that didn't pass, but I'm hoping for help next year getting it through. It was the very first year for this bill, and it often takes 2 or 3 years for a good bill to pass. So I don't want you to be discouraged, and I do want you to think about this. And that's that right now, the court system is being used as a weapon against sexual assault survivors. So we've had cases where we had one woman sexually assaulted by her doctor, and she reported, she filed criminal charges. She went through the whole process. She did everything that we asked her to do as a survivor. In fact, she was actually responding to what she saw on TV, which was a prosecutor saying, if you've been sexually assaulted by this man, showing a picture of the doctor who was the sex offender, then please come forward. She did. He turned around, he sued her for defamation, for intentional infliction of emotional distress, for interference with contract, for a long list of civil claims. And he was doing that to try to get her not to make those allegations. We see it in college cases where we urge college students to come forward, report sexual violence, and then they find that they're in the middle of an expensive, time-consuming, emotionally exhausting, really horrible civil lawsuit. Now, look, it is really important that we have access to the courts, but this bill would have said, we are going to say everybody has access to the courts. But if you have disclosed sexual assault, sexual violence, then we're going to say that the other side, the person who is suing you, just has a higher burden. And that if they lose, we're going to have that person pay for attorney's fees. You know, it's really important. It's one of those small things that are actually silencing survivors, which is the name of the title, is Stop Silencing Survivors. It was sponsored by the amazing Senator Sarah Love from Montgomery County and Vice Chair Sandy Bartlett from Anne Arundel County. They did a fabulous job, and we hope to see that bill back again. This one didn't pass, so I do have to just take a moment on a slightly higher note and say that because of your advocacy, because of the advocacy of women and advocates and our allies across the state, we were able to defeat proposals to cut victim services in Maryland. We were able to defeat proposals to cut rape kit testing funding in Maryland. So we really did respond to the budget crisis in Maryland. And so I wanted especially to say thank you, but also to say that right now in history, it's just never been more important to speak up, to speak out. And I want you to add another date to your calendar, and that's June 5th. Because at the federal level, they are trying to cut services for survivors of sexual assault, for survivors of domestic violence, and many of the things that really help people become safe and create safety for their family and for their kids. So June 5th, keep your eyes out for that. Join us in activism to speak up, speak out, and keep fighting at the federal level. And I will see you next year to fight the good fight at the state level. And hopefully we will be able to pass Stop Silencing Survivors. Thanks.
Thank you so much, Lisa. I am looking in the chat and I don't see any questions. And so there is an opportunity where you can ask Lisa 1 to 2 questions. And so I'll give us about 30 seconds to gather a question, to collect any questions that may come through.
All right, while you do that, Sheena, let me just say that you've got many fabulous organizations on this call, and pick the one that speaks to your heart. If you want to learn more about survivors of sexual violence and what's happening with those issues, go to mcasa.org. We'll tell you all about June 5th. We'll tell you about what you can do to advocate at the federal level. And then when Annapolis is up and running again, we will help you there as well. The bill number is House Bill 629 and Senate Bill 549 for Stop Silencing Survivors. It just didn't get a vote at all.
Alrighty. Thank you so much, Lisa.
Thank you, Sheena. Thank you all.
Okay. Have a wonderful evening. So our next bill, we're going to start with the 5 bills that passed. The next bill is HB 297 SB 5, the Maryland Health Benefit Exchange, which is the state-based youth adult health insurance subsidies pilot program, the sunset repeal, and it's going to be presented by Stephanie Clapper with the Maryland Healthcare for All. Stephanie, you have 2 to 3 minutes to present.
Great. Well, thank you all so much for your support for this law. We're very excited that it passed. The Young Adult Health Insurance Subsidy Program helps young adults who are trying to purchase private health coverage through Maryland Health Connection. These are young folks who are not offered coverage through their employer or otherwise don't have access to health coverage. And so the program has been working well. Over 67,000 young adults approximately per year have been taking advantage of it. And this is disproportionately more young women have been using these subsidies to buy health coverage for the first time, to upgrade to plans with lower copay so that they can actually use their insurance. It's helping young women have a good access to healthcare and better health outcomes. It's helping young women get access to preventive services like Pap tests and blood pressure checks. And this year, it needed to be renewed in order to continue. And thanks to your support, it has been renewed. It has been made permanent, contingent on funding. And we expect there to be funding through at least 2028. It's funded through an assessment on insurers, which also pays for a reinsurance program, which helps stabilize premiums in our individual market, as well as the Health Equity Resource Act, which MLAW also supported in previous years and helped pass. So it's a big success. And since I'm talking about that bucket of money, I just wanted to give you all an update that the Health Equity Resource Act is working well. And I'm going to just put in the chat later a PDF that includes all of the wonderful programs around the state that MLAW supported to create, which are improving health outcomes and reducing health disparities around Maryland. So thank you so much for all your support for those.
Thank you so much, Stephanie. Does anyone have any questions for Stephanie? Because she will be presenting on the next bill that passed, that I'm really excited about. So I'll give you about 10 to 15 seconds to write your question in the chat.
While folks are doing that, I just really wanted to thank our lead sponsors, Delegate Kerr and Senators Lamb, Feldman, and Hayes, and note that both the House and Senate bill passed the Senate unanimously. They passed in the House on a partisan vote, except for Delegate Hornberger, Republican, who voted for it. So, so it was a bipartisan piece of legislation.
Thank you so much, Stephanie. And seeing that there are no questions, we're going to move on to the next bill that passed, which is House Bill 424, Senate Bill 357, Prescription Drug Affordability Board, the Authority and Stakeholder Council membership, which is the bill for lowering prescription drug costs for all Marylanders Now Act.
So this is a big accomplishment. Thank you, MLAW, for your support and advocacy to make this happen. We have been fighting for this for many years together. And so this legislation gives the Prescription Drug Affordability Board the authority to set upper payment limits for high-cost drugs for all Marylanders. Back in 2019, we successfully advocated for the creation of this board and its ability to set those upper payment limits for high-cost drugs for state and local governments. We expect Governor Moore to sign this legislation on Tuesday that would expand its authority to be able to do that for all Marylanders. Now, we're hopeful that this summer, the board will set upper payment limits for Jardiance and Farxiga for state and local governments. For the first time, it would be the first time that a board like this anywhere across the country would be setting upper payment limits for drugs. And if they do that this summer, then they could start setting upper payment limits for all Marylanders for those drugs as soon as next summer. So that's the timeline that we are hopeful for. The lead sponsors were delegates Bonnie Cullison and Jennifer White Holland and Senators Don Guile and Brian Feldman. And this legislation is going to be especially impactful for women because women are currently more likely to have to skip or ration their medication. They're often on the hook for their children's medication, as the majority of single-headed households are led by mothers, and many of the most prohibitively expensive medicines on the market are for diseases that disproportionately impact women. For example, Herceptin is a drug used to treat breast cancer, and it's been around since 1985, but still costs over $60,000 per year. So we have high hopes that this will make a big impact. And we want to thank the legislature and Governor Moore for their support, both HB 424 and SB 357. They passed both chambers on a partisan vote, except for Senator Simoneau, Republican senator, who did vote for it. And it's on its way to the governor. So it's a huge accomplishment. Truly, thank you from the bottom of my heart for your support for this. And moving forward, if you know anyone or have a story about how the high cost of prescription drugs is harming you, we are looking to connect folks with the Prescription Drug Affordability Board because it's going to help assist them in doing their work. So thank you so much.
Thank you so much, Stephanie. So I'd like to pass it on to the next speaker for HB 334, SB 156. Oh, I'm sorry. I think I jumped ahead of myself. Does anyone have any questions for Stephanie regarding the last bill on the lowering prescription drug costs for all Marylanders Now Act? Any questions? Okay, seeing none, we're gonna move on to HB 334, SB 156, the work group on universal newborn nurse home visiting services, presented by Sarah Price with Frederick County, Maryland.
Hello, everyone. I'm Sarah Price. I work for the Frederick County Executive in her Government Relations Office, and I'm going to give you a quick overview of the House Bill 334 SB 156. First, I just wanted to start with a huge thank you to Senator Karen Lewis Young and Delegate Ken Kerr. They really carried this bill and did a phenomenal job of representing what the program was. So this bill initially aimed to establish the Family Connects model statewide. This is a program model that is run in Frederick County and Prince George's County. It's a universal nurse home visiting program, which provides all families in Frederick County with a free nurse home visit at roughly 3 weeks. Prince George's County also has this model, and Baltimore City has their own universal newborn home visiting program as well. It's just not called Family Connects. So with Frederick County's program, the nurse does a comprehensive assessment with a risk rating for each family across 12 factors of maternal health, infant health, household safety, and parent well-being. The nurse then provides the family with personalized resources and additional targeted services based on the results of that assessment. The program is universal, which assists in reducing the stigma around free home nurse visits and really allows us to help every family in Frederick County with newborns. We have seen phenomenal results with this program. We have ER visits have went down substantially. Social service cases 5 years out have went down with this program, and it's caught things from maternal postpartum depression to infant heart defects or other cardiovascular problems. So it's really been a phenomenal program in our county. The bill did not pass in the original form, but it did pass as a work group bill. So this amended bill will create a work group to study the different models for newborn home visiting services across the state, including Frederick County, Prince George's County, and Baltimore City. The work group will consist of a variety of members, including members from the General Assembly, a nominee from the Secretary of Health and Maryland Hospital Association, a representative from each site in the state implementing these programs, and a representative from each organization implementing these programs, local health department representatives, and more. The work group will be tasked with studying data on each of the existing programs, expenditures for these programs, service gaps between them, opportunities to align the programs, and potential funding sources and workforce needs. The work group will report its findings by December 31st of this year, and that will assist us in determining next steps. So once again, huge shout out to the sponsors and MLAW for being very supportive of this legislation. Former County Executive Jan Gardner was also very supportive of this legislation. So we had a really strong coalition this year, and we're very excited to see what the work group results are.
Thank you so much, Sarah. I'm monitoring the chat right now to see if anyone has any questions for you.
Great.
Okay, so I'm going to give the attendees about 15 seconds to put a question in the chat.
And thank you for the opportunity to present on this bill.
Oh, absolutely. Thank you so much. Looking forward to seeing what comes out of the work group.
Yes, so were we.
Okay, so there is a question, and it says, are there plans to make this a statewide program?
So that was what the initial bill had aimed to do, but the legislature wanted to learn more about it, and that's why they're having a work group. The work group report will really give us those next steps on if it's feasible and if there's interest in the General Assembly to make this program statewide. But it's a phenomenal program, so we really hope that that's possible.
Okay. And are there any other questions for Sarah? Right. Thank you so much for your time, Sarah.
Thank you.
Okay. So okay. Oh, there's a special thank you. Special thank you to MLAW for helping to pass the Health Equity Resource Act in 2021. The programs to improve health outcomes and reduce health inequities are up and running around the state and are seeking patients that could use their program support. And there is more information attached for those who may be interested in learning more in the chat. So the next presenter is going to present HB 930, SB 848, which is the establishment of the Public Health Abortion Grant Program by Robin Elliott with Public Policy Partners. Robin, you have 2 to 3 minutes.
So good afternoon, everyone. I am so excited to be able to be on the column of bills that have passed. Thank you to everyone here. This bill had a huge turnout in terms of support, people testifying, people writing. And I know much of that is due to the great work of MLAW. So a quick overview of this bill is that it is the first in the nation bill to take a funding source of unspent insurance premiums for abortion coverage that are just sitting there, essentially collecting dust because of some restrictions in federal law, and instead repurposing them for the first in the nation public health grant that will support abortion care for people who are uninsured, underinsured, or too afraid to use their insurance policies because they're afraid of that explanation of benefits going home. I'm really so thrilled to be in Maryland. This bill supports Marylanders, and it also recognizes that there are people coming to our state without resources who also need support. So Maryland is opening up its compassion to individuals all over the country. I really want to give a huge shout out to our wonderful bill sponsorship team, Delegate Leslie Lopez, her Chief of Staff, Emily, Senator Guy Gazzoni, who is this year's sponsor, and last year's sponsor, who is on this call, Senator Ariana Kelly, who, although no longer a senator, was very much at that witness table in terms of having her presence and her wisdom and her vision behind this bill from last year. So big thank you to our sponsors and all of you for supporting it. And with this, we have 25 million and 3 million more each year to support care that people who really need it at a time when we don't have much good news. This is incredible news. So thanks to all of you.
Thank you so much, Robin, for all of your hard work. And I completely agree with you. At a time like this, we need to hear great news, especially when people don't have other options. So I did get a comment in the chat that says, Robin is the GOAT. Yes. And so I'd like to open up the floor for questions. I will give you 15 to 20 seconds to drop your question in the chat. Or if you have another affirmation of praise for Robin and her team, as well as all of those who made this bill possible. Yeah. Okay. All right. Thank you so much for your time, Robin. Yes. Okay. And so the final bill that we'll have presented, that was one of the 5 that passed, is HB 933 SB 697, nursing home cost reports. And that will be presented by Jabron Eubanks from 1199 SEIU, United Healthcare Workers East. Jabron, you have 2 to 3 minutes to present your bill.
Thank you, Sheena. Yes, again, Jabron Eubanks with 1199 SEIU. We are a labor organization that represents primarily healthcare workers. And I'm here to present on HB 933/SB 679, the Nursing Home Care Crisis Transparency Act. This bill is sponsored by Delegate Ashanti Martinez and Senator Jim Rosapep, so we really appreciate the support there. We also want to thank MLAW for your support on this legislation. It was crucial in amplifying the issue of nursing home oversight and transparency to the General Assembly. So just a little bit of background as far as the nursing home industry in Maryland. Right now in Maryland, our nursing homes are often going through a churn of nursing home owners and operators. And our members can tell you that with each change in owner, the quality of care diminishes. This bill aims to improve reporting requirements in Maryland. Currently, cost reports do not capture enough information to enable CMS to fulfill its regulatory obligation to ensure taxpayers' dollars are going towards care and not profits to owners and operators. Currently, the data shows that the population of individuals living in the lowest ranked facilities in Maryland are disproportionately people of color, mostly Black, and that is not an accident. Systematic racism lies in the root of these disparities, manifesting by racially segregated care, low Medicaid reimbursement, and lack of livable wages for staff, which all worsens these disparities. 90% of residential long-term care workers are women. And in Maryland, the average hourly wage is $15.43 for nursing assistants in skilled nursing facilities. And wages are so low, and the demand to work under staff burns our workers out and pushes them to leave the field. Many direct care staff, including custodial services, dietary aides, CNAs, and GNAs, are working at multiple long-term care facilities just to earn more money. Our members can tell you that nursing homes are gaining more and more high-need residents who have been discharged from hospitals, but due to short staffing, staff are unable to adequately care for their patients, leaving a lot of these residents to be left unattended in substandard conditions. So originally, our bill was aimed to ensure that 75% of skilled nursing facility revenue goes towards direct care and the women-led workforce that it provides. Facilities would have to report that they had met the 75% direct care cost requirement through their cost reports. However, through conversations with the Maryland Department of Health, the bill was amended to ensure that MDH analyzes all Maryland nursing home cost reports and to report how much of the revenue nursing homes currently spending on direct care workers, so that we can establish a spending threshold in the future. So we do think that this is a positive step in the right direction, and we look forward to working with the Department of Health. And we know that, strengthening oversight of nursing home revenue will have a direct impact on the quality care for our most vulnerable residents who are aging with disabilities.
Thank you so much, Jabron, for all of your hard work and in your presentation. So if you have any questions for Jabron, please put them in the chat. I'll give you 15 to 20 seconds to do that. Okay, thank you so much, Jabron, for all of your hard work and presenting on this bill. So we're going to move on to the bills that did not pass. We already presented on the first bill that didn't pass, HB 629, SB 549. That was presented by Lisa Jordan. Lisa Jordan, for those who may have arrived later. And our second bill that didn't pass, HB 647, SB 702, the presenter, Natasha White, had to hop off to take care of a matter, but promised to share an update with us via email, which we will have our team here at MLAW get out to all of those who have registered to attend. So the information from HB 647, SB 702, Correctional Services, Restrictive Housing, the presenter had to hop off. So we're going to move to the another bill that did not pass, HB 1050, Family Law, Protective Orders, Surrender of Firearms, SB 943, Family and Law Enforcement Protection Act, presented again by Robin Elliott with Public Policy Partners. Thank you so much, Robin.
Oh, sure. So first, I just want to acknowledge that this bill, the advocacy group behind it, is Marylanders to Prevent Gun Violence. I am actually not their advocate. I'm the chair of their board. And I want to give a big shout out to Karen Herron, the executive director, who led the work on this bill and is on a well-deserved break this week. This bill, as we've heard, is on the did not pass list, but I will just add yet. I think, as Lisa Jordan said when she presented, that bills often take a couple years to pass. So this bill essentially looks at having a more uniform and effective process in all 24 jurisdictions when there are protective orders to also make sure that firearms are removed from the person who is posing the threat. So it looks at sort of from the beginning of the process, making sure how can we make sure the courts have better information to make the decisions, and thinking about how can the courts apply the law more uniformly. Huge thank yous to the bill sponsors, Senator Shelley Heddleman on the Senate side, obviously, and Delegate Sandy Bartlett on the House side. Their work was tremendous. We feel very optimistic in terms of the future of this bill. It is clearly very needed, and we look forward to working with MLAW, and think we will probably be back at whenever the November event is, asking for MLAW support again, because it makes a huge difference. And just a shout out to this organization, because it's a wonderful way to reach different groups of advocates who might not normally be in your sphere of, for example, criminal justice. And so we just really appreciate this opportunity.
Thank you so much, Robin. I'm going to leave about 15 seconds just in case someone wants to drop a quick question for you in the chat. So I don't see any questions, Robin. Thank you so much for your time again on this the incredible work that you've done despite the bill not passing. Yes. So our next bill that did not pass, unfortunately, is HB 1198, SB 632, Correctional Services, Comprehensive Rehabilitative Pre-Release Services, female incarcerated individuals, which is the Monica Cooper Pre-Release Act. And it is presented by Monica Cooper, with the Women's Pre-Release Equity Coalition.
Hello, everybody. Good evening. I am Monica Cooper. And yes, unfortunately, the Monica Cooper's Act did not pass this session. We are certainly not going away. We have been at this since 2016. We're not going anywhere. And the update is, one, it passed from the House, flying colors, went to the Senate, passed out the Senate, but it passed out the Senate with amendments. And those amendments, once it went back to the House to kind of, make the bills match, then it got caught up in rules. And then once it got caught up in rules, it was just all of this foolishness, I'd like to say. So the bill didn't pass, but I'm encouraged that, one, it passed both the houses. We were hoping that it didn't get any amendments and it would come out clean, and then it would have just went to the floor and it would have been a done deal. So we are definitely looking at maybe bringing it back. How can we do it better? But even more, we are presently faced with the Department of Corrections trying to build this what they call the Life Skills Reentry Center for Women. They are trying to build it at 717 4th Street, which is extremely small. It doesn't fit what the statute says. It's 0.97 acres, and the statute clearly says that the site should be at least 2 to 4 acres, so that would give the women an opportunity to have a space large enough to house them. It would give them an opportunity to have a space that would be able to receive their children when their children visit, and all of these other gender responsive programs that need to be there. So what the Department of Corrections is currently doing is, and the Department of General Services, they are trying to get a $3 million extension on funding so that they can start at 717 4th Street. We oppose that. So what we are doing is we are going to try and get, I believe it's the Department of Public Works, to vote no on the extension for the $3 million because they are trying to hurry up, rush, and build this center that is not the statute. It's not what we need. It's not what the law says. But they know that they have been, behind in making this happen. They should have been sued 3 years ago. We really should have took them to court 3 years ago. So they're trying to hurry up and build this center. But even worse, once they build this center, the women supposed to get their programming, their services from the Baltimore Therapeutic Center. The state wants to give the Department of Corrections $1 billion to build this facility. And the facility is supposed to deal with mental health, substance abuse, and those things, and people that need that assistance, while at the same time supposedly trying to deal with women that's coming home. You have two different populations. Some of those, when those women come home, they are not caught up in the throes of addiction, so it don't even really bode well. But it seems like, and it feels like the Department of Corrections is doing anything they can to kick the can down the road and make all kinds of excuses and put all of these things in place just to simply prevent from having to build this center. So we are currently in the process of trying to stop it immediately being built at 717 4th Street. And we're in the process of getting DPW to actually vote no and refuse to give them the $3 million. I thought I heard
Okay.
somebody say something.
Yeah, thank you so much for all of this background
Mhm.
information, Monica. This really puts things and gives us a better perspective. I do have two questions for you in the chat. And
Sure.
the first question is, where is 717 4th Street? Is that in Baltimore? And is
That
this a facility for the entire state?
that is in Baltimore. It's over East Baltimore. It's actually a parking lot.
Okay.
They are trying to build this pre-release center for women on a parking lot. It's no parking. I mean, I could just go on and on. All of the reasons why we oppose that, like 1,000,000,001 reasons. And it would be for everybody in the state. The previous pre-release center was at 301 Calverton Road, and it had 144 bed capacity. It was large enough for women to have the visiting room for their children. It was large enough for them to have their religious services, people to come from the community. It was large enough for Catholic charities and all of those organizations that provided services for parenting, provided drug treatment services and whatever else they needed. It was large enough to accommodate that. And the bill itself specifically says that we need gender specific programming and a space to actually house that.
Yeah,
And the one
Monica,
Calverton Street did accommodate everybody from around the state would attend or would be at that pre-release center.
and there's one final question for you in the chat, and it is,
Hmm.
do the men have a center?
Oh yeah. Oh yeah. They originally had, I think it was 9, and then they have about 5 now.
Okay.
They have 5 centers where they are allowed to go out, get jobs. They're allowed to go out and work. They are allowed to have weekend passes where it's a halfway house where they could go home to their families on the weekends and come back to the center. In fact, Dorsey Run Road is a 500 bed facility, and everybody is considered at pre-release status. Pre-release status is minimum, pre-release, and work release. All of
Okay.
these people would be housed in that space, and we don't have to reinvent the wheel. There was already a pre-release center that had all of the programming, all of the work opportunities, all of the college opportunities. They just need to have the will to open a pre-release center back up.
Okay. And I'm glad
Mhm.
that you said that, because our final question before we move on to our next bill is, well, one is a comment. It says that the center needs to have wraparound services. And then the final
Mhm.
question is, Can they renovate the Calverton location?
Oh God, that would be a dream. Oh, from your lips to God's ears. Oh, child. That would be a dream come true because what's crazy is that the center is still there. It's in pristine condition on the outside. It will be so much cheaper to go in and just renovate it. Everything is still there. The healthcare facility is still there. The chow hall is still there. Everything's in place, just like it originally was in 2009. Um, the state claims that space is no longer available. They say the MTA is supposed to be having something in it, but that it's been sitting empty ever since. That would be a great idea to just go right back into that space that they shut down in 2009. I like that suggestion.
Well, thank you so much, Monica, for all of your hard work.
No, thank you
We're
guys.
right
You
here with
guys really
you.
pushed us over the top. Thank
Yeah,
you.
and I wanted to share an affirmation. And it says, thanks to all who worked so hard on these issues, from Pat Stocker from AAUW.
Oh, yay,
And
Pat.
yeah,
Hi,
and then I have
Pat.
something from Kate Campbell Stevenson. And Kate says, I'm proud to be from Maryland, but such
Hey,
excellent advocates who work for sensible laws to protect women and improve women's lives and safety. Thank you, MLAW, for who amplifies these important efforts
yes.
and will continue to build our progress step by step, onward and upwards. Onward and onward. Thank you so much. And thank you so much, Monica. Thank you for
Thank you
pulling over
guys.
and taking time from your
Yes,
commute to give
yes.
us this great information from your vehicle. And I pray that you get to your destination safely.
God bless you guys. I love each and every one of you. I can't tell you how much the support means. Really, the support means everything. So I
Well,
love y'all.
thank you so much, Monica. We
Thank
love you
you.
too. Take care. And then there's another Bravo Zulu from Cassandra Freeman, National Council of Black Women, Southern Maryland. We hope to take up the mantle. Absolutely. So our final bill of the 10 that did not pass is HB 1368, SB 314, certificates of birth, licenses, and identification cards, which is the Sex Designation Birth Certificate Modernization Act, presented by M from Trans Maryland. Thank you so much, M.
Thank you so much. Thank you for having me, and thank you everyone for being here tonight. Thank you, MLAW, and to all of the wonderful advocates here for your incredible effort supporting us in our work on this bill. It's sad to say it's in the did not pass column, and I'll speak a little bit more to the background and experiences of that. But I think I'll just start by saying that, as I imagine folks here are very well aware, is a very difficult time for trans people in the country right now. Trans people in the state of Maryland, trans women, families with trans individuals. And this bill, from its original inception many years ago.
over here now.
Sorry, I think I hear another.
Is
there everything okay?
Could you also speak a bit louder, please?
Yeah, of course. Sorry, I keep having trouble with my computer recently. Yeah, so going, as I was saying, incredibly difficult time and moment for trans folks here. This bill, the goal was to support trans people as well as trans parents of youth, and as well as parents of trans youth, just families in general, in accessing accurate identity documents. It was a very simple change back from its inception as a bill several years ago. My colleague, the policy director at Trans Maryland, Charlotte Hoffman, has been working on this for a while, but unfortunately couldn't join us for this part here. I currently serve as director of research for the organization. Should have included that as I was talking at the beginning. But the bill essentially was to make it easier for folks to change the sex designation on a birth certificate, as well as for parents to be able to update their names if their name had changed for any reason on their child's birth certificate. So that being an incredibly important way that individuals show parental connection with their children. This bill would have just made it easier, made it such that people didn't have to bring additional documents as they navigated schools and other contexts if they had changed their name for gender transition related reasons or for any other reason, for safety reasons, etc. And so this bill, actually, we were very optimistic at the beginning of the session, again, in part due to the incredible advocacy of this organization and the partner organizations here. We had amazing sponsors, Senator Lamb and Delegate Martinez, who are really pushing for this legislation. And it even ended up on a voting list in the Senate Finance Committee, but it was pulled at the last minute by the Senate president due to concerns that trans issues were too controversial in the present moment, particularly with the budget situation. And so that was incredibly disappointing for us and also for all the effort that the advocates were putting into it and our incredible partners and allies, because as I mentioned before, this is an incredibly challenging moment for marginalized communities broadly. And this bill would have plugged a really important gap in our accurate identity documents to support communities in a moment where we needed it most. So looking forward, we're going to be continuing to work on this bill. My organization also, I'll put a link in the chat, is going to be doing a lot for Pride Month going forward and looking for ways where we can continue both through legislative action and through other actions to support families and different members within our community amid the current crisis that we're facing as federal attacks continue against our community. And so we'd be grateful for your ongoing support and engagement as we do that, as we hope to also partner with you all in supporting the causes that didn't make it through this 90 days, but hopefully can come back stronger, as strong as ever next year. So thank you all for your time, your space, your support. I'm so grateful to be a part of a community of advocates like this one.
Thank you so much, Em. And while it didn't pass this year, we're confident that, we're going to keep on pushing and working together as a coalition to support you in any way that we can. So I'm going to open up the floor for anyone to drop their questions for Em in the chat. And I'll give you about 15 seconds to do so, or 15 or 20 seconds to do so. If you have any questions for Em, please drop it in the chat. Okay, thank you so much. We don't have any questions in the chat for you today, but I'd like to thank you. Oh, someone did say, how can we help?
Yes, thank you for that question. Yeah, there are a lot of different ways that we're looking for support. I think with our organization in particular, we also do like direct services with, trans folks, helping them with updating exactly these identity documents that we're talking about, finding other supports and things like that. So I understand our organization is currently also raising funds to be able to support people with direct with like the cost associated with name changes and identity document changes. So you can see a link to donate if you're able to do so there. I think additionally looking to what's going on in your local communities, because we're seeing a lot of the anti-trans actions like, trickling down to local school boards and spaces like that, and being able to engage in advocacy work within your local communities where you help, people feel heard, feel like their stories and experiences matter, help connect them with resources, healthcare, education, other things like that. And then otherwise just follow our social media, sign up for our email list where we're going to be continuing to push out. We've been pushing out action alerts as well. So as like things at the federal level happen, as agencies, for instance, try to do things like limit Medicaid coverage for gender affirming care or other things that affect communities, because trans people are within every community. We're going to continue like pushing out, information about public comment, other sort of events like that, court cases, that sort of thing where we can use support. So with things changing day by day, if being in touch and keeping up with kind of what we're putting out will help sort of show where the evolving needs are. I wish I could give like one clear action, then we'll be all good, but there's a lot of uncertainty in the space as well. So appreciating, folks' flexibility in that way. I'll also put my email in the chat if people want to follow up with me after.
Yes, thank you so much, Em. And you can also visit transmaryland.org to find out other ways to connect with M and to support their mission and their campaign. So next up, we will have Angela McDaniel, who's our MLAW Vice President, to chat to share with you our 2025 success and ask you to raise a glass. Angela, I pass it over to you.
Hi, Sheena. Can you hear me okay?
Absolutely, we can hear you clearly.
Wonderful. And so this is our time to set aside, do a cheer, a toast for all the good work that you all have done. And really what you're doing is you're building your legacy. Remember, our young adults, our children are watching you as you impact your lives, your family lives, and the citizens in the state of Maryland. Local politics is all politics, and that's what you all are involved when you work with MLAW and your other organizations. We're impacting health, reproductive rights, our working lives, and the safety of our citizens and families. So thank you, all the women organizations that are on here, the MLAW members, our senators, delegates, representatives, and our ancestors whose shoulders we stand upon. We greatly appreciate all of your efforts, whether it be small, big, all of us can help and make a difference. You have seen how local politics impacts national, the Supreme Court justice, and the presidency as well. Please keep doing what you're doing, ask questions, write letters, be involved, and toast to you all for this 2025 year. See you next year. Thank you.
Okay, now I want to turn it over to Tahira Hussein, who is going to tell you a little about how to get involved with MLAW.
Hi, I'm Tahira Hussein. I'm a board member. I'm involved with the MLAW, and the reason I'm involved, I'm asking all the participants, all the non-profit organization and their member, whatever we did in past 25, 30 years, because we got support from you guys, and you brought so many issues, and as a bill, we get to get them passed and help so many people. I'm encourage you to become a member for MLAW and be an advocate for all voiceless in our community. And we are going to have November 1st, our big event. And if you register as a member, you're going to get all the information and update about the bills, and you can participate, and you can be as a partner, you can work with us for advocacy, lobby, what we do in Annapolis. And I really encourage all you to go in our chat box. Jessica just posted the link. So become a member. Very minimum. What we are doing, the membership fee is nothing. So please be a part of this organization who is helping around us. So many women, they don't have voice. Thank you so much.
Okay, thank you all for participating in tonight's wrap up. We hope to see you in November at the MLAW Annual Fall Legislative Conference. Again, the date is Saturday, November 1st, and it will be at the Meeting House in Columbia. That's the same location that we were at last year, and it was a great location. Please mark your calendars for the conference, and we hope to see you in November. Good night.